As you all might be aware, radiotherapy is high energy rays, like Röntgen rays were invented by Madame Curie. Later on came different isotopes and also the high energy releasing particles and matter. So the particulate rays which are derived from the source of radiation, like linear accelerator nowadays. Previously we used to have that cobalt 60 therapy, wherein high energy rays are produced and liberated from the cobalt, the isomer, and they are focused on the tissues where the tumor is present, and that used to extirpate the tumor. There were also side effects of that cobalt therapy, now which is almost getting into oblivion and outdated. We are using nowadays mostly all over the globe the linear accelerator, wherein the energy rays are artificially synthesized and produced and projected onto the tumor tissue. And as a recourse and development to the linear accelerator, there are various improvised gadgets have come, including tumor assisted or tumor directed high energy rays, that is called IMRT, that is intense modulated radiotherapy, IGRT, image guided radiotherapy. So many. And you might have heard of what is called rapid arc, which came into existence about 20 years back. It is a the dose enhanced and the time decreased form of radiotherapy, that is called rapid arc. And also the side effects of these improved gadgets like IMRT is very minimal, because the focus is on the tumor site only. The surrounding normal tissue is not affected much or very minimally affected, so that the bad effects of radiation are minimized. So this is radiotherapy, wherein as an outpatient the patient goes there after the simulation and treatment planning system and all that. The energy rays are given appropriately, and as the tumor diminishes over a period of time, that is called grating, the focus is also reduced. The area of focus of the radiotherapy is reduced, so that normal tissue is not affected. So that is what is called the image guided radiotherapy gadgets. All these newer gadgets, including true beam, help to minimize the side effects of the radiation on the surrounding normal tissue, and also improve the tumor ablation precisely and specifically, so that the patient feels all the time near normal even while undergoing radiotherapy. This is the main difference, whereas it is a no touch technique rather. Of course, there is also, apart from the external beam radiotherapy, there is what is called the intracavity radiotherapy, which is given using an isotope into the cavity. For example, cervical cancers, there into the vagina it's kept the radioactive, that is what is called intracavity radiation. So there are different types of radiotherapy, which is a gadget oriented and a kind of outpatient procedures, whereas chemotherapy is always hospitalized either for a day or 3, depending on the protocol, and strictly under supervision of the medical oncologist and his team. Supportive care, the chemotherapy is administered. Radiation oncologists do a lot of physics and also the mapping of the tumor. By arranging the topography of the tumor, the rays are directed.